This is Dr. John Wyckoff. Welcome to another edition of Pathways to Wellness. We're about finding that functional and integrative approach to your chronic health issues. I'm a board-certified family physician, but I left the conventional world, which really struggles with chronic illness years ago, and entered into the world of functional or integrative medicine, where we try to find the root cause or causes of your health issues. That's what we do at Wyckoff Wellness in East Lansing. I encourage you to find us by stopping by our office at 1226 Michigan Avenue in East Lansing. We're right on the western edge of the Michigan State campus, Michigan State University. We are just east of Frandor, if you know Michigan East Lansing area, just west of the Harrison Roadhouse, about 4 blocks. Happy to talk to you at our office. You can look us up online at wyckoffwellness.com. Call us at 517-333-7270, 333-7270, or Google us at Wyckoff Wellness Center or wyckoffwellness.com. Today's topic is one that I think, again, it's just not understood well by conventional physicians, not managed well by conventional physicians, and that's allergies. We're going to talk about food allergies, pollen allergies, chemical allergies, how some of that relates to autoimmune disease, and how we can bring a integrative approach, a different approach to your allergy treatment. So, allergies they're mystifying. We got 50 million people or more, that's at least 1 in 6 of you, that suffer from pollen allergies, things to dust mites, mold, pets, trees, ragweed, things like that. You just don't, oftentimes you have seasonal allergies, and a lot of people have ragweed problems. That's kind of coming to an end right now in Michigan in the fall when we get a good frost. But you may have spring allergies to the trees, summer allergies to grasses, fall allergies to weeds. And allergies vary by the region of the country. The people that live in the southwest or southeast have different allergies than people that live in the upper Midwest. So pollen allergy is very, very common. We see it in many, many people. You can get the symptoms of a runny nose, itchy eyes, cough, sneezing, postnasal drip, asthma. One of the things I see in children especially, and it just befuddles me, I really believe any child who's diagnosed with asthma or any type of restrictive lung disease, they need to be tested for allergies. And people say, I don't want to go through that skin testing and skin prick. And that's one way to test for allergy. But we can test for allergies very efficiently with something called a RAST test, R-E-S-T, just a blood test. And we have an allergy panel that we can get that looks at 88 common foods. It looks at the common pollens in this part of the world. We can actually customize this. If you have problems in Florida, not in Michigan, we can get the types of testing for pollens that are part of the southeast United States versus the upper Midwest. So just one blood test can help sort this out. We can get testing for mold, for gluten grains. So it's really very inexpensive and easy to do. Find an integrative functional doctor like myself, Dr. John Wyckoff. Get the testing that you need. Because when we talk allergies, we're going to try to talk about avoidance as the first step. It's hard to get better no matter what you do if you can't avoid the allergies. So if you've got, let's say, for example, dust mite allergy, you need to dust mite proof your home, especially your bedroom. That means you need to get dust mite covers on your bedding. You need to wash them in hot water every week or 10 days. You need to get away from having carpet in your bedroom and going to a hard surface floor. Anything that dust will collect, dust mites will follow. Maybe get away from the fancy duvets and pillows. Keep it pretty basic. Changing your pillows. One thing I remember when I was a little boy, I can never understand why every year my pillow seemed heavier. Maybe you notice this at home. I say, my pillow, how does it get heavier? I think it's just dirty. Well, it wasn't dirty. It was full of dust mite feces. I know that's really gross, but this is why pillows get heavier, is that you have dust mites. The dust mites defecate, and really that's what you're allergic to. You're allergic to the dust mite feces. So, I mean, how this works, and I know it's kind of gross and disgusting, but it's important you understand it. Dust mites defecate on the fabric. You put your head on the pillow, the dried dust mite feces aerosolizes around your face, and for all night long as you move and toss and turn, because you're not sleeping well due to your allergies, you're re-inhaling dust mite fecal material. Really gross, but that's why you get allergies, and that's why you're sick. So do things to mitigate that. Getting a good quality HEPA filter in your bedroom throughout your house. You can take it to the extreme. We work with a group called Allergy Control Products. I'll show this up here. This is a brochure we give all of our patients. You can go to Allergy Control Products, just Google them. They have products for your bed, for your house, filters. If you have environmental allergens, they can help you with products to improve cleaning, remove allergens, filter your air, change the filter in your furnace, your HVAC. Do it every quarter. That is a simple thing. You can buy more sophisticated filters to put on your furnace. They're not a bad idea. HEPA filters and the like. I encourage you to explore that. The more you reduce your exposure to pollens that you're sensitive to, the healthier you'll be. If you have food allergies, maybe you've got to eliminate those foods or be treated for them, because you will not get rid of the allergy if you keep re-exposing yourself to the allergen. So take charge of your health and wellness. Control your allergies. Now, treatment, what do you do if you have allergies? Well, the conventional approach initially is to put you on antihistamines. Block the allergic response. Makes all kinds of sense, doesn't it? Well, if we give you an antihistamine, we block histamine, which is the mediator of allergy. That's how it's got its name, antihistamine. Sounds good. It's all good and great until you start to realize the side effects that these medications have. The first generation antihistamines like Benadryl are very sedating. They're quite effective, but things like Benadryl and Atarax, they make you tired. If you use them occasionally at bedtime, it's probably fine, but they're not a good long-term choice. So we have the second generation antihistamines. They called the quote-unquote non-sedating antihistamines, things like Allegra, Zyrtec, Claritin. And that's really a misnomer. They're still sedating in a significant percent of the patients, but not as much as Benadryl. But they have other side effects in terms of cognition, and you're taking a pill every day. I just don't believe that that's the best way to approach allergies. But it's an approach some people use is antihistamines. The third approach is allergy immunotherapy. This is using an injection form. You go to your doctor, your typical allergist. He'll see you. He'll do some skin testing, maybe do a blood test. He'll develop an allergy extract, and he'll build up your tolerance to the identified reactions that you've had. That's conventional allergy immunotherapy. It's modestly effective, but you have to go in usually once a week for an injection. It's kind of a hassle. You have to sit in the office for maybe a half hour after the injection, to make sure that you don't have an anaphylactic reaction to the injection, which can be fatal. And you got to keep going back, sometimes for years. We do a different therapy called Low Dose Allergen Immunotherapy, LDA. You can Google Low Dose Allergen Immunotherapy, or LDA, and learn more about it. This is an injection therapy, but it's just one injection every 2 months for 6 months, 6 injections for 1 year, and then every 3 months for the second year, so 4 injections, a total of 10 injections over 2 years. We get about 80% cure of allergies with our treatment. Conventional immunotherapy, years of therapy, about 65% resolution of symptoms. In our case, with low-dose allergen immunotherapy, 80% improvement at 2 years, and of that 80%, half of those people will be allergy-free the rest of their life. Half may need like a once or twice a year booster, an injection, but they're going to do well. Now, we're going to talk about LDA. LDA can also be given in an under-the-tongue form, a sublingual immunotherapy. That is not something we do at Wyckoff Wellness, but there are practitioners around the country that do. So pursue allergy options beyond conventional immunotherapy. We're going to talk now a little bit about LDA, Low Dose Allergen Immunotherapy. This is not for everyone. And I always give our patients a lot of information to make sure they're ready to embark on the LDA process. One, it takes some time. Two, it has some cost. It can be quite rewarding, and I'll share with you a couple of my success stories. But you need to be ready to be free of your allergy symptoms forever. Are you willing to commit 12 to 24 months to treatment? Are you willing to have one injection every 2 months and then less frequently as you go forward? Are you willing to follow the guidelines or diet, medication, supplements, and activities around each injection? We'll talk about the 3 critical days in a minute. And are you committed to improving your allergy symptoms, possibly forever, and working with us to help you achieve that goal? Now, if you can answer yes to all 5 questions, you're probably ready to proceed with LDA. LDA is completely different, though, than traditional immunotherapy, which is related to IgE-mediated allergies. This neutralization therapy works through developing tolerance. But LDA, we're going to turn off the T cells, the mediators of allergy. T cells have a fairly long life, so this is why we don't have to give the injections every week. We can do the injections initially every 2 months. So it's much more convenient for you. You don't have to come in every week, get your injection. We're using an ultra-low dose of allergens in our LDA mix. We're not going to get anaphylaxis. We're going to watch you for 20 minutes or so afterwards, but we've never had severe reaction. I think there's been over close to 1 million LDA injections given. No one has had an anaphylactic or a reaction that's killed them. So you can't say that about conventional immunotherapy. There are always a handful of deaths around the United States every year, probably because the wrong amount is given or the wrong vial is used, and people have a severe reaction and they can't be saved because the reaction is so severe. We can use LDA in children down to 2 months of age. I have had small children on LDA. We can use LDA to help heal the gut. And I've got a previous podcast on healing the gut and autoimmune symptoms, diseases, and we didn't talk much about LDA, but that's a good treatment for things like rheumatoid arthritis, ankylosing spondylitis, Crohn's disease, ulcerative colitis, rheumatoid arthritis, psoriatic arthritis, fibromyalgia, Sjögren's syndrome, interstitial cystitis, ITP or idiopathic thrombocytopenia purpura, and even chemical sensitivity. We can use LDA for those problems. So if you have an autoimmune problem, don't be afraid to investigate LDA. Google it. Call our office. We'll tell you about, we have some bacterial antigens that we combine with our conventional LDA mixes to get you on that path to health and wellness naturally. Now, LDA doesn't work for everyone. It fails. Primary failures because people don't follow the rules. You don't follow the rules, you'll have adverse reactions, or it just doesn't work. Improper dosing or timing. It is imperative that you come in every 2 months for the first year. We have a window between 7 weeks and 9 weeks. 8 weeks is the sweet spot. You can come up to a week early or a week later. We get outside that window, the efficacy goes down. There can be interference from your gut. If you've got candida, we may need to address that early before we go after LDA. You have to have a healthy gut. We don't want you to have heavy metals. So if you've had dental implants, silicone breast implants, if you have a dental abscess, maybe we got to deal with those issues first. And sometimes LDA just doesn't work. As I said before, it will work in about 80% of people. So what are the disadvantages? There aren't many. It takes 6 to 8 injections to achieve a sustained effect. That's why we need you to commit to a 1 to 2 year process. If you're not willing to commit that and come in to see us every 2 to 3 months, LDA is not for you, not following the directions. And we have a detailed book I'm using as a reference today called the Low Dose Allergen Immunotherapy Guidelines. It's available on our website at wyckoffwellness.com as a PDF download. Easy to get through. We give it and go through it with all of our patients. We categorize our patients into 3 levels, 1, 2, or 3. A level 1, almost we never see someone that has just one pollen allergy. For example, hay fever. Most people who have one allergy have many allergies. And level 2 is our most common patient. They have intestinal problems, food issues, autoimmune disease, with or without pollen problems. And our level 3 patient, our more challenging patient, they have chemical sensitivities. So we have guidelines for level 1, level 2, level 3 people. But what's really important, especially for level 2 and 3, is that you follow the LDA diet for the 3 critical days. The 3 critical days of each injection are the day before, the day of, the day after the injection. LDA centers around those 3 critical days. We put you on a pretty restrictive diet of lamb, rabbit, venison, or fish. If you're not allergic to any of them, some people get by with buffalo, sweet potatoes, yams, parsnips, rutabagas, turnips, or cassava root, cooked carrots, celery, cabbage, white potatoes, lettuce, tapioca, rhubarb, pure baking soda, sea salt, bottled purified water. But margarine is not safe to be used. You can, if we need something, natural butter. We have an LDA diet. We have LDA recipes to help you through that. There are a number of medications you cannot use with LDA, so we'll talk to you about that. There are certain supplements that you can take that potentiate LDA. We'll talk about that. And we'll talk about medications to avoid. Sometimes you can't do things like reading newspapers, magazines if you have chemical issues because of the exposure to those chemicals. You may need to stay out of the supermarket for a few days. The smells from the aisle where they have cleaning fluids and detergents, those can make people really sick. So, we need to learn about LDA and be comfortable before we go forward. This is Dr. John Wyckoff with another exciting edition of Pathways to Wellness with yours truly, Dr. John Wyckoff. Listen to us wherever you find podcasts, whether it's Spotify or YouTube. We're going to be there. Also, you can learn more about us on the web at wyckoffwellness.com, WYCOFF wellness.com. Just Google us, Wyckoff Wellness Center. We're in East Lansing at 1226 Michigan Avenue, just on the western edge of the Michigan State University campus, just a couple miles east of the Capitol. Easy to find. You can stop in. You can purchase any supplements in our office. You don't have to be a patient to stop by our in-store store, or you can purchase our supplements online at wyckoffwellness.com. Encourage you to check it out. We do a lot of promotions online on our supplements. We partner with Metagenics. You can get the entire array of Metagenic supplements through the Wyckoff Wellness online store. Not just the stuff we have in our office, but they have hundreds of products that we don't carry. You can purchase them by clicking on the store or shop now tab on our homepage, wyckoffwellness.com. Encourage you to shop there. And as I said, oftentimes specials are run. So to learn more about us, keep listening to our podcast at Pathways to Wellness with Dr. John Wyckoff. Back to LDA. Certain medications really do interfere with LDA. Antibiotics are just an absolute no-no. So if you're on antibiotics, especially a week before or during the 3 critical days, we're not going to do LDA. Antihistamines, they're unsafe to use with LDA. They just will blunt the response. Claritin, Allegra, Zyrtec, Benadryl, most medications for autoimmunity like Enbrel, Remicade, Arava, these have to be stopped before we do LDA. Decongestants, pain medications, all of them, they're all problematic. Anti-inflammatories, there gets that word inflammation that causes allergies, interferes with LDA. Sometimes we've been able to get a compounded form of ketoprofen called Arudis, may be safe. The codeine, oxycodone, Vicodin, Percocet cannot be used. Asthma inhalers blunt the effect. Aspirin, immunosuppressive drugs, Singulair, synthetic estrogens. Bioidentical hormones seem to be fine, but Premarin, Prempro, Premphase, Ogen, estrase, all of these have to be avoided. Estrogen implants or patches, birth control pills, any of them. So you have to understand which medications to get off of. Certain supplements are a problem. And then again, certain supplements help potentiate LDA. Zinc, magnesium, folate, especially in the form of methylfolate, vitamin D, caffeine may be fine. Some people go on a caffeinated compounded capsule around the time they have LDA. So we can help you with that. Tofranil is one antidepressant that is safe. So there are ways to get you to improve your response to LDA. And as I said before, LDA is such an amazing therapy because it's, one, more effective than conventional allergy shots. Two, it's given much less frequently, and it's much over 2 years. You just have to have one shot every 2 months for a year, every 3 months for the second year. And of that group, 50% of those people never need another injection ever. All of their allergies are gone. So there's a commitment of time and effort to you, but the results can really be amazing. So I'm going to share with you one of my great success stories. I had a young patient named Erin who came to me. She was 8 years old, cute as a button, 3rd grade, and she had the worst eczema I had ever seen. Her entire face, torso, legs, arms were covered with eczema. The family had been all over to see multiple dermatologists. They'd gone to Cleveland Clinic, and really all they had to offer her now was an autoimmune drug with a gazillion side effects, some very, very serious and permanent, and they just didn't want to go down that path, and they had heard about LDA, and I was just starting using LDA, and they walked into the room. So you can imagine this. I'm not really quite sure how the LDA works. I'd gone through training with Dr. William Schrader, one of the real pioneers of LDA in the United States, and felt confident in my ability to diagnose and treat allergies and use LDA, but my experience in my office was limited. So you can imagine this visit where the mom says, "We want LDA." She knows more about it than I do. And I said, well, let's try. And so we get her prepped. We do the testing. She's got multiple food allergies. She's got leaky gut problems. We clean up her diet, clean up her gut, get her off the medications that are problematic, comes in, gets her injection. And I said, let's come back in 2 months and see how she does. Well, 2 months later, she comes back and she's running up and down my hallway like 8-year-olds do. Eczema looks as bad or worse as it did when I saw her first. And I go, oh, well, it's not going to be a good visit. Walk into the room and the mom and dad are there and they're happy as larks. I said, well, how's Erin doing? Dr. Wyckoff, it's amazing. Her eczema cleared for 3 weeks after the injection, just like you predicted it would. And you told us it probably would come back and that each injection would be built on the next or on the previous one, and she would get a longer and longer effect. So we're so eager to get her second shot. And I said, really? I said, it was gone? She goes, yes. Skin cleared. Allergy symptoms went away. Came back, but she had 3 great weeks. So we continued to treat her every 2 months. And by the 3rd, 4th injection, she was allergy-free and eczema-free for the entire 2 months. It was just absolutely amazing. She had one little fleck of eczema on her upper lip I can never, ever get rid of. So we used a little chapstick and moisturizer, and somehow she was good. But her skin was beautiful. Her complexion was beautiful. And the side story that really taught me a lot with Erin is that Erin was the 4th child that these 2 well-educated parents had. The other 3 were academic stars. They were bright. They didn't need help with their homework. They did great in school. Well, Erin was kind of the class clown. And they just kind of figured, Erin just didn't get all the marbles that the older siblings did. Well, what happened after Erin had gone through LDA is that she became an academic star. She ended up being valedictorian of our high school class. Her brain was on fire due to her allergies and her leaky gut. And when we got control of that, her ability to concentrate, her distractiveness went away. She was just a kid who didn't understand why her brain didn't work like all the other kids' brains. And that is so common. We see this in functional medicine. So the lesson for all of you who maybe have trouble with focusing and have been told you have ADD or ADHD and they want to put you on medications, look for the root cause. Allergy can be one. Leaky gut can be a part of the issue. Find someone like me, Dr. John Wyckoff, who does functional medicine, integrative medicine. Find the root cause. I have a bigger toolbox at my availability. I'll do a thorough history. We take about an hour with each of our patients initially to sort through the problems. We get conventional testing. We get our biomedical testing, put together a list of problems, try to find the root cause, whether it's genetic or allergy or hormones, supplement, diet, what it is, and give you a multi-pronged approach to be proactive and take charge of your health. Find us at wyckoffwellness.com, wyckoffwellness.com. Listen to other podcasts at wherever you listen to podcasts. And it's a Pathway to Wellness with Dr. John Wyckoff. Call us at 517-333-7270, 333-7270. Talk to Cindy. She'll do a great job of helping you understand what we do, how we can help to you. She'll talk to you for a long time. She knows as much about this as I do. Visit our website at wyckoffwellness.com. 517-333-7270, 800-471-0255. We're in East Lansing, Michigan. It would be a privilege to be of service to you. Take charge of your health. Get on that path to health and wellness and start today.